Hi, I've been in healthcare since 1983. I've done all the financial things that you could probably do without having to be a C-level person. And I like to think that there's things I know that they don't know, and this is one of those things. As I've gotten older, I've had to go see more doctors, and because I also take care of my mother, she has to see a lot of doctors. So, one of the things that's starting to bother me more and more is how much paperwork there is to do. I'm going to give you two examples. I had to go see a doctor for sleep apnea. I have a CPAP and I have to see a doctor every year and a half. That's just how it is. I don't understand why. Not like I have anything that's billed to insurance company, but I guess it's New York state law that I have to see a doctor every year and a half or so. Every time I go, they say, well, we need to have you fill this stuff out. And I say, why? They say, well, we're supposed to do it at least once a year for a patient to see the doctor. And I said, why? He said, well, because things might have changed. I said, what if I tell you that nothing has changed? I've lived in the same house for 19 years. I've had the same phone number for 19 years. I've had the same insurance for the last 5 years. They say, well, because it's our policy. It's a stupid policy. Now, I didn't say that directly to them, but I was thinking that because one of the things that irks patients, and now I'm one, and now, because my mother is one more often, is that there's all this paperwork that's needlessly given to us to do, and no one really wants to see that stuff. Now, if you've got people who are transient, maybe. But in a lot of communities, people have stayed in the same place for a long time. There is no need to have to do all that stuff. All you have to do, and you do it this way, is you ask a patient, where do you live now? They tell you, you look at your paperwork or your computer, it's the exact same thing, and you're done. Now, that's story number one. Story number two, I've mentioned, maybe here or my other channel, I'm not really sure where, that I had a car accident back in February. I've got a problem with a tendon in my right shoulder, and I'm seeing someone for that. I'm starting to do, physical therapy. Had a cortisone shot, didn't work, but I had a cortisone shot. My insurance company decided I needed to see one of their doctors. I don't know why, but they decided I needed to do it. So I showed up on Tuesday for the appointment. Now, the doctors were late. Of course they were. Still, I showed up. And this woman gives me this 5-page thing. And I said, okay, what is this? She said, oh, well, we need you to fill this out. And I said, well, wait, your insurance company and my insurance company sent this, had me come here. They have all the information. They have everything they need. Oh, well, they need to have their own paperwork. Why? Well, it's just a standard thing. Why? And I actually did say, why? I said, they have everything. If the insurance company wanted me to see this doctor, they should have sent everything that was needed. And she said, well, I'm sorry, but this is just a process. I said, okay, fine. And they asked a lot of things that I didn't think had anything to do with my shoulder. Some of it I just skipped because I tend to be that way. Like I said, I've been on this side and I recognize when there's some stuff that I say, okay, this isn't pertinent. I'm not answering it at all. And so I had to fill all this stuff out for these people and I had to sign it. They say, well, we need a copy of a card that has your face on it. I'm thinking, why? I didn't say it this time, but I'm thinking, why? My insurance company made me come here. So I had to wait 90 minutes for the doctors to show up for a 3-minute appointment. And I had to fill out 5 pages. Although, like I said, I skipped a lot of stuff. Because a lot of those questions, they just don't apply to me. This didn't matter. I'm, no fault. And I know why they wanted me to see the doctor. I figured it out really quickly. But still, healthcare needs to find a way to get paperwork under control. I know why they're doing it, because there's been a lot of incidences of doctors who have performed surgeries on the wrong part of the body. There's been, doctors who walk in there who don't ask enough questions up front, and they're treating things that aren't what they're supposed to be treating. There are times, I'll acknowledge this, where someone is moving around. I mentioned transients earlier. And they'll just agree to an address or give you an address of where they used to be, and now you've lost them. You know what? That's just the name of the game. That's just how it is. But to keep giving more paperwork is ridiculous. especially for Medicare people. Medicare people already have tons of paperwork. And then for these folks to say, well, we have to do it again because it's our policy, it's a waste. You know, there's a lot of waste in healthcare. I will own up to that. But I think that there's a waste of time with a lot of the paperwork. Just get the signatures. You know, when I've been going to physical therapy, all I do is tell them my last name, what time I have the appointment, and then they've got this little electronic thing and they say, okay, sign your name on that. And I sign my name. They say, okay, fine. Because they got everything. I just think that, you know, we have to find a way in healthcare to streamline some of this stuff. I was part of an organization some years ago that actually went to Washington, D.C., and that was one of the things that we had to gripe about was this proliferation of paperwork that was just driving people nuts. But they had other things to think about, so that wasn't going anywhere. So think about this, not just in healthcare. You know, yes, I'm talking about healthcare right now, but talk about business. Businesses do that as well. They've got all this technology, but they still want all this paper. And then they just do all this stupid stuff that is just unnecessary. It's overkill. Stop it. And I wish I could tell you the rest of why I said stop it and why it's so funny to me right now. But just suffice it to say, we need to get control of ourselves. We need to get control of paperwork in healthcare. It's a lot of waste. And in traditional businesses, if you're doing a lot of stuff that you really don't have to do, you're just doing it for your comfort level, stop it. That's what I got today. My name is Mitch Mitchell. I hope y'all have a pleasant week.